In today's mental health check, teens are facing a mental health crisis in this country. There's no other way to say it. But what if artificial intelligence could help? NBC News technology correspondent Jake Ward is here with me. Jake, we should warn viewers that we are going to talk about preventing suicide here. This is a potentially positive use of AI.
That's absolutely right, Kate. I mean, we know that AI can pick patterns out of data that a human analyst really cannot see. Well, it turns out that artificial intelligence may, in fact, be able to get out in front of the signs of some very distressing mental health crises in young people.
20-year-old Joe Whelan was smart, kind, and funny.
Come on, boys. Keep up.
But his parents say he struggled. First, with an eating disorder that started when he was just 12 years old.
We had no context of where that might be coming from.
A search for answers finally revealed that Joe had been sexually abused by a trusted family member. He battled complex PTSD for years, which led to inpatient care and partial hospitalization. And then COVID hit, resulting in a lack of beds at his treatment center.
That was as long as he could hang on.
Joe died by suicide in September 2020. A 2021 CDC survey found nearly 1 in 4 American high schoolers had seriously considered taking their own lives. But with a national shortage of therapists, experts at Cincinnati Children's Hospital are now using AI to identify the risk of anxiety, depression, and suicide early in kids, using signs even the most well-intentioned parent or expert might miss.
Our goal is to move upstream and reduce the flow of behavioral and mental health illnesses.
Doctors Tracy Glauser and John Pestian built the model themselves. They trained the AI to spot patterns not just using structured data, height, weight, the stuff you record during a doctor's visit, but also unstructured data, like the language used in conversation and even in the messages left behind by people who've attempted suicide.
You have a library of suicide notes.
Yes.
Wow.
They found that the AI was able to pull signs from even the most subtle patterns in language, like how often someone uses nouns rather than pronouns.
Those that aren't suicidal will use the word I more often than those who are suicidal, and they don't refer to themselves that often.
Wow. So if in the language of the suicide note they refer to things other than themselves more often, they're more likely to commit suicide.
They showed us other examples. This one, a patient who was diagnosed with anxiety during an April 2020 visit. Additional data, like language and speech, revealed that that patient already had a high risk for anxiety 8 months before, something a doctor might otherwise miss. Cincinnati Children's wants to make the AI tool available for pediatricians, teachers, parents, anyone who can make appropriate use of missed signals.
Is this going to make the shortage of human therapists worse?
It does not make diagnoses. It does not provide therapy. But what it does is it helps focus people on who's the one who needs the help right now.
The Whelans built this bench to remember Joe. They say they would have turned to anyone or anything, including AI, for help.
I don't think there's an AI solution that's going to solve this problem. I think you're going to need people to people, but we are incredibly short on those people right now.
Yeah, that's for sure. Jake, it's fascinating. Is this just a tool for therapists right now, or could it actually ever replace human mental health professionals?
Well, the creators of this particular program, Kate, basically say that this is just a tool. It's a way to focus attention on people that we might otherwise miss. And it's important to point out here, right, that the Department of Health and Human Services says that by 2025, we're likely to be down about 10,000 therapists. That's how many we need. That's how big the gap is. And so making them more effective is the short-term goal, and that's where AI is helping us.
Yeah, they need it so much. And as someone who lost someone to suicide, thank you, Jake, for reporting on that. And if you